Hey, Shubhra, thank you for coming in. You got this marvelous background from an academic standpoint, from a business standpoint, from investments, and just really understanding the health and life sciences space as well. Just an incredible history of success. Or thank you for coming in and sharing your experiences with my audience.
Of course. Thank you for having me, Stephen.
So, Shubhra, you got this remarkable history of success, and what were those three inflection points that made you who you are today? And it could have been when you were 3 or 5 years old. It could have been when you were a teenager. It could have been inside or outside the family. It could have been somewhere in school, outside of school. Could have been some early jobs. In fact, yesterday I did an interview with somebody who's been the CEO of these big conglomerates, and he said, really, it started with a paper route. Oh, and his mother was single, so he really had to kind of come to the table with kind of capabilities and stuff like that. But he talked about this sort of very modest journey of getting to where he is today. So it could be anything. So what were those three sort of defining moments for you that made you who you are today?
Yeah, it's interesting. So if I think back to early life, I'd say one of the incidences that comes to mind from earliest memory was this time. Just for context, I grew up in a small town in India, and both my parents were doctors, and they came from very humble backgrounds and started their own private practice and developed that into a hospital over time. And one memory that comes to mind is when I was very young, and my dad was in the kitchen cooking us lunch. We both, I have a younger sister, and we both had just come back from school, and my dad was in the kitchen making some bread for us and serving us lunch. And someone knocked on the door, and I answered, and they asked, where's your dad? And by that time my parents had already established the hospital and they were running it. And I said, he's in the kitchen cooking me bread. And this person who was a staff member essentially started laughing, and he said he's needed in the OR. They were doing a surgery, and there was some complication that had developed, and my mom had sent this person to call my dad. And in the traditional Indian setting, it was not usual for a male member, and especially a sort of well-established CEO of a hospital system, to be cooking lunch. And so when this staff member went back to the OR and said, he'll be here shortly, he's cooking lunch for his children, everyone in the OR sort of sneakily started laughing. And that later that evening, we were talking about that incident as a family, and my dad was like, so what, like, what, I have no shame in doing this, like, I was feeding my kids. And there is no work that is too small or too big. Like, my dad is not even a surgeon, but he was the person who got called upon for any problem at any point in time, anywhere. And when that complication developed in the middle of the surgery and nobody else was able to handle it, he was called upon. So his point was, there is no work that intimidates me. There's no work that is too small or too big, and I'll just give my best effort to anything that I am doing. And that sort of that as a memory has stuck with me for all of my life, where I've made my earnest effort to not be intimidated by the task in front of me. But at the same time, I'm also not feeling humiliated by anything that needs to be done, and that's in the service of the larger mission that I am a part of. So I would say that was probably the earliest sort of formative memory that I have. In terms of defining moments, another one that comes to mind was when I decided to move from clinical medical practice into the world of technology and business. And again, in the culture that I grew up in and the community I grew up in, India is a very rigidly structured educational system. So it's not very common for people to switch careers like that. And medicine, especially, is considered such a respectable profession. And so it was just kind of taken for granted that once you've gone through medical school, your parents run a hospital, like obviously you'll be a practicing doctor. And to the extent that when I said I wanted to explore other things, people really questioned if that was even possible, if I was in my right mind to even be thinking about that. And how could anyone possibly do that? Because it was unheard of in the Indian education system. And I had to face a lot of resistance from my peer group, from my own family, in making that transition. And some part of it was judgment, but also I think some part of it was fear on their behalf, because there was all this uncertainty. Nobody really knew what path lay ahead in front of me, and if I will be able to figure out a successful career outside of clinical medicine, given that's where my fundamental training was. So it took 4 months of sitting in my parents' basement and cold emailing professors and technologists from around the world to finally get some responses and figure out a path to Stanford. While I was in the process of doing that, I had to face the peer pressure and pressure from my family, and just it required me to believe in myself in a way that I have never had to do before. And really stand for what I believed in and what I was passionate about. And I think I'm very thankful that I did that, because I feel very fulfilled professionally with where I am today. And I I just found a new kind of strength within me that said to me that if you deeply believe in something, and if you want something with all the passion in your heart, then the universe kind of delivers. And that, I would say, I've has given me given me the strength to go through some difficult times, moving forward in life as well. The third thing I would talk about is probably my experience that I went through during COVID. That was a particularly difficult time. I live alone in this country. All of my family is back in India. My parents are both doctors. They're on the front line. They were running a hospital system. And there was a time when India had a really bad second wave of COVID, where most families lost someone. My dad is a cancer survivor. Both my parents are diabetics, so they're immunosuppressed. They were seeing patients the entire time, um, for the entire COVID period. I was alone in this country and so scared that if something were to happen to me, there was absolutely no one to even check on me. The flights were canceled between all the borders were closed, so nobody could go anywhere. I was scared for my life. I was scared for my parents' lives, and just mentally really isolated. I also went through a job transition during that period, where I left the last firm I was with, and I was doing some deals on my own. And that was a really challenging period without any kind of social interaction. I remember for 4 months, when they had first declared the lockdown, I would sit in the lobby of my apartment and I would see people walking their dogs downstairs. And that was my only dose of seeing a human being for 4 months was that. I literally didn't see a live human being for 4 months. All of this while going through the career transition and constantly worrying about my parents, and if something were to happen to them. And during that period, lost my grandmother who raised me. When I was born, my mom was still doing her training. So my grandmother raised me for the first couple of years, and we were really close, and wasn't even able to go for her last rites and her funeral because all the flights were canceled. So it was just a different kind of mental health challenge that I went through during that period, and was literally counting days for it to be over.
So that's a remarkable journey. I mean, you talk about your dad making a meal for the kids, and he's a noted doctor and also a CEO in essence, right? These hospitals that he's spun out, and he's willing to just be available anytime there's a need. No job is beyond actually participating or working in, and to be maintaining that humbleness as well, right? Uh, Making a meal for the kids and for the family and things like that. So I can see how that would ground you, provide a kind of a solid grounding. Because both of your parents are doctors, then you would have an interest in science and healthcare and things like that. And I could see then, your early journey also had this kind of science and medicine aspect, and you ended up being a clinician. And then you decide to pivot, right? And you search around to see how you can pivot, and you end up, doing engineering at Stanford. You get an MBA from Wharton, so they're really the two top institutions, literally in the world, from a technical business kind of area. I mean, engineering is very practical, right? Very grounded, and then an MBA from Wharton, which is one of the top schools from a business standpoint. So, and persevering. You'd have people pushing back and yet persevering through that and saying, you know what, I'm determined to spread my capabilities to other areas as well. And then, as you mentioned, COVID and just the pressures of COVID and losing a dear person in your family who basically was your mentor as well, right? And what that meant, and this kind of the challenges and overcoming those challenges. So just a remarkable background of dedication, of talent, hard work, perseverance, resilience, and passion. Passion for your vision and to maintain this sort of direction in your vision. So you do this pivot, and you get through COVID, and then you end up as an investor, right? Was that your next move? So can you describe that investment journey and then where you are today?
Yeah. So that was a journey of its own. So when I was at Wharton, in between the 2 years of MBA, I did two summer internships. I did an investment banking internship at Bank of America in their healthcare group, and I did a summer internship at a small venture firm called Red and Blue Ventures in Philadelphia. Um, I knew it very quickly that I wasn't really cut out for banking. And really enjoyed my experience working with a small venture firm in Philadelphia. Uh, and so I decided that I wanted to do investing. But for whatever reason, venture capital has just become a very competitive industry to break into. And I was significantly at a disadvantage being in Philadelphia because I wasn't really there. There aren't that many firms in Philadelphia, and it's a very networking based recruitment process. So I would one thing that I would be thankful for in terms of my experience at banking was it gave me this insight that I saw these bankers making pitch books for the investment firms. I saw them, and as a summer associate, I would be tasked with basically preparing a slide or two, or moving some boxes around, or building the financial model behind one of these slides. But they would prepare these pitch books that they would then take to private equity firms or investment firms, where it would lay out the market map of a particular sector and lay out attractive investment opportunities in that sector. And the insight that I had was, if I can make it for Bank of America, why can't I just make it for myself? Um, and so that's what I did. I would pick a thesis area, and I still remember the first one I picked was substance abuse and mental health back in 2016. I would pick a thesis area. I would make a full pitch book, 50, 60 pages, outlining all the regulations in the space, the market size, the different areas within the space that may be attractive to invest in, and identifying some concrete companies where an investor should invest. And to the extent that I was able, I would get in front of these companies and try to build a relationship with the founders and all of that. And so during my second year at Wharton, when I had decided that I wanted to be an investor, I would pre-book flights to California every 6 weeks. I would spend 4 days in California and meet with anyone in the investing universe who was willing to meet me, and take my pitch books around and pitch them on my ideas. Just cold reaching out to them as a student. And I did, I mean, that was a tough 1.5 semesters of doing this, but I built a pretty good network in the industry doing that. And started interviewing for some jobs. Going from there, I got 5 different job offers, but nobody wanted to sponsor a visa. And then I finally had one firm, which was run by two immigrant Iranian founders. And I think they understood the immigration struggle, and they were willing to sponsor a visa for me. So I ended up joining this firm called Coda Capital, which was at their first fund at the time. And they gave me my break in the industry, essentially. But by the time I had that job, I mean, I had a partner from Sequoia and a partner from Orbimed who offered to be my references, because I had taken my pitch books to them for the last 6 months, even though I had never worked for them. So I think the hard work that I did in trying to break into the industry served me very well and helped me build a network in the investing community, which I continue to foster and strengthen as I go forward. But yes, so Coda Capital was the first firm where I joined as an investor. I was the first healthcare person there. I built a healthcare presence and practice for them, and invested in some healthcare and life sciences companies. Coda is a generalist firm. They do both public and private. They do all kinds of technology investments, stage agnostic. So we carved out a little niche for us on the healthcare and life sciences side with my presence there.
Yeah, I mean, you established and led the healthcare vertical of a 1.5 billion fund. So that's significant. And it's not minor. It's a big one, right? So, and prior to that, I mean, you did have these consulting roles with Warburg Pincus and TCB, right? So how did this lead to where you are today? Tarsadia, is that, or?
Yeah, it is called Tarsadia. So between Coda and Tarsadia, which is the transition that I talked about during COVID, essentially, I did some independent consulting work, and I did some independent deals. So I consulted for some investment firms like the ones you mentioned, but I also just invested on my own and raised some capital around deals that I did. So I did about 7 investments and raised some capital around them. And as I was doing that, I was starting to think about maybe raising a small first fund worth of capital instead of doing it deal by deal, because I was already doing it deal by deal. And I reconnected with a classmate of mine from Wharton, Rishi Reddy, who was at the time working already at Tarsadia. And he offered me the opportunity to come and join Tarsadia. He said, "Why, we have this permanent base of capital. We manage $2.9 billion in assets. We've done a little bit in healthcare and life sciences already, and we're looking to deepen our bench of expertise and our commitment to healthcare. So why don't you come in-house and lead the healthcare vertical for us?" And so in 22, I joined them, and I now lead healthcare investments at Tarsadia.
And your background is such a perfect fit. I mean, culturally, you come from a society, a region of the planet, which is just exploding from innovation, hard work, and a clinical sort of medical background as well, right? So you're kind of infused in that space. And then you've got this engineering, which is very data-driven, kind of very precise. And then you've got the MBA from Wharton, which has that very business-centric financial aspect in spades. And you've done your own investing. You've been putting together pitch books and things like that, just doing all of this independent research. So it's a really perfect confluence of your talent and all of the skills that you've acquired through, again, talented hard work, and then, you know, directing all of that experience and capabilities in your investments. Can you talk about the things that really excite you in healthcare and life sciences?
Oh, sure. I think healthcare and life sciences is really well poised to benefit from this wave of AI that we are getting to experience. And I call this the leapfrog opportunity that healthcare has in front of itself. As is probably no news to most of us, the healthcare system has been a laggard in adopting technology. I mean, we're the only industry that is still faxing documents on a daily basis, hundreds of millions of documents, and that's how we communicate, which is crazy in 2025, right? But I think what healthcare has in front of it is, and I thought about this as a parallel the last time I visited India, actually. I realized my parents actually never had credit cards. They used cash everywhere. And now they just use the UPI and digital payments that India has come up with. And so they just never understood and valued credit cards. And I think the whole emerging economy essentially leapfrogged the credit card revolution. And I think that's the opportunity that healthcare has today in front of itself. So we spend about $35 billion in healthcare on all kinds of software solutions. We spend $800 billion on labor and services. 70% of healthcare spend is services. And for the very first time, with AI being as good as it is now, we have the opportunity to go after that market size of $800 billion as services with AI-enabled services, or agents, as people are calling them. I think there's definitely this massive opportunity where, instead of, the reason why healthcare has been a laggard in adopting technology is because we have the most highly skilled and trained workforce in healthcare. And it's incredibly difficult for them to take time out of their very stretched schedules already and retrain themselves on things that they did not learn in 15 years of their training to adopt a new software system that their hospital has just bought, or things like that. And that's why we have been lagging in adoption of technology in healthcare organizations. But for the very first time, with AI agents or AI enabled services, we don't have to retrain the existing workforce necessarily. We can just augment them and take some parts of their workflow and just execute it for them, giving them essentially a virtual assistant. And that can actually be value additive rather than creating more burden on them to document more, to train over and over again on new technologies, all of that. But what is required for that to happen is, well, maybe let me take a different approach to getting there, which is both Elon and Sam have come out and said LLMs have already consumed all the human generated data that's out there. You know what they have not consumed is healthcare data, because it's locked up in all of these silos and not publicly available. Here is another stat that is shocking, which is 30% of world's data is healthcare data. And 98% of it is unused. And most of it is unused because it's unusable today, though in the shape and form that it exists. All of these provider organizations and hospital systems have ownership of their own patients' medical records. It's not until recently that they were incentivized and now actually mandated to share those amongst each other and with patients. 21st Century Cures Act actually mandates that every provider organization make the patient records available to patients upon their request, or to another physician who needs them for taking care of the patient. So for the first time, we have both the regulation and the infrastructure that is needed to start unlocking the silos of these data assets. The other thing that has happened on the biological side is sequencing has become more democratized and affordable than it was ever before. You may have seen that chart of Moore's law and the cost of sequencing dropping faster than the cost of compute. And tools and companies like Illumina have come out and they have basically democratized sequencing, not just genomic sequencing, but also all of these other omics, the multi-omics revolution, the proteomics, the transcriptomics, metabolomics, which are sometimes much closer to actual physiological expression. So genome is what is locked up in your DNA. But if you have studied the central dogma of biology, DNA gets translated to RNA, RNA gets translated to protein. And protein or metabolites is what gets expressed in your function. And so the closer you can get to measuring the proteins or metabolites, the closer you get to measuring what will actually be seen or expressed. Someone may have an Alzheimer's gene, but may actually never develop Alzheimer's because that gene never got expressed. So there's value in measuring things that are closer to expression. And now we have the tools to do so. All of these tools are generating petabytes of very valuable biological data, which we today don't have the ability to process, synthesize, analyze, and hence we're throwing away 98% of it. So there is this massive opportunity to unlock 30% of the world's data that is trapped in health and bio, and build AI solutions to help us discover better drugs, provide better and more relevant, more personalized care to each patient, at the same time control the burgeoning costs that we have in this country of providing healthcare. So I think that's the massive opportunity in front of us, and it's an open site and it's up for the taking.
And you're so perfectly situated, both you personally and then, of course, your investment group as well, right? Because you've got this trillions marketplace across the world, and increasingly, as you indicated, it's going to unlock this green field of health, which has been resisted for a long, long time, right? But now it's ready, and as you mentioned, that there's kind of this normalization of the data, so it can be shared, and then kind of more uniform, like a data commons that you can then use to drive all of the AI inferencing and AI sort of analytical capabilities that are in AI. It reminds me of a company called Pangea Data. I interviewed the founder, and he got a $300 million non-diluted grant because he's able to unlock or save, I think it's $1 billion a year in the UK healthcare system, and it's just looking at clinical records, and something like 80-90% is misdiagnosed or not even that it's not even discovered properly, and just using AI over it, they're unlocking all of this capability. So, and they're in the Microsoft Pegasus program, which is their unicorn builder. So, but you're at the forefront. I mean, your background, what a perfect synthesis. How do you see then this influx of things like you have deep research, these deep research tools? I mean, OpenAI released their deep research tool, but so has Gemini or Google, so has Anthropic. I mean, they're all releasing these tools that do deep research. They're agentic, and they just go off and do things for you. And then that's then sort of touching on maybe elements of AGI, artificial general intelligence, where it's like the equivalent to the best of us. And then there's people like Ilya Sutskever are saying, you know what, I'm just going directly to say superintelligence, where it's better than the best of us. And then you have this whole robotics embodiment revolution. For example, Figure AI just came out with their Helix model, which is the vision, language, action, and it generalizes it. You can give it a foreign environment, it just generalizes and it knows. And where do you see all of this? Where do you sit, I guess, in this sort of revolution that's occurring? And then we'll get to things like quantum and supercomputing, amalgamating with AI and machine learning. But so there's kind of evolution that's compressing on the AI side. Do you think it's coming in the near term, or do you think it's still quite a bit off, especially in healthcare?
I think it's definitely coming. There are some parts of healthcare and biological workflows that will adopt AI faster and benefit from it faster than some other parts for of some reasons that are obvious and some that may not be so obvious. I think, for example, I mean, you may have heard about this company just launched called Open Evidence, which is all about enabling physicians and scientists to access the latest evidence. Thousands of medical research papers are getting published every day. It's impossible for a practicing clinician to stay on top of the latest medical research in addition to handling their daily caseload, right? So this platform makes it super easy for them to ask very specific targeted questions that are relevant to their workflow and their patients, and get answers at their fingertips, not only for physicians, but also for scientists. So there are things like that that are what I would call low hanging fruit, which is essentially aggregating the existing information, helping us access those insights in a more user friendly and actionable way. Um, and then, I mean, it's funny you mentioned AGI because we have this term that is starting to be talked about in biological circles, which is artificial biological intelligence, which is essentially getting to a point in time where we are able to figure out the perfect translation of central dogma. How do I structure and construct a genome that then also expresses at each point in a perfect way for me to see an expression of certain specific traits? And again, there are a lot of ethical considerations around that. Like there are a lot of regulatory considerations around that. So that's an example of something that's, I think, much further out. And we'll be working towards that and hopefully finding some cures and improving the quality of life of some patients for diseases that were not curable before or mostly had palliative care before. And then on the robotics side, what we're seeing is a lot of efficiency gain, and so every hospital system, the number one problem that they're suffering from is shortage of labor. um, an average hospital system turns over their entire staff in 5 years. Can
Wow.
you imagine running a company like that? It's crazy how much attrition there is because of how much burnout there is, how much dissatisfaction amongst employees there is. And so, if we can improve the quality of life of this workforce of the doctors and nurses and prevent burnout and allow them to practice at the top of what we call at the top of their license, doing the things that only they are well equipped to do. Turning over a patient in bed or wheeling a patient from the bed to the MRI scanner is not something that you need a nursing degree to do. So why are we using our nurses to do those kinds of things? So this is where I see the physical intelligence revolution coming, where I don't think we're very far from where all of these manual tasks that don't really require um, clinical knowledge or experience or are not very high risk will be done by robots, essentially intelligent robots. And it will start from the lower level, lower acuity, lower risk tasks like turning a patient in bed or wheeling them to different appointments. And then it will progress to putting a PICC line in a patient or doing actual robotic surgical procedures, right? Like, so not we have already seen that happen with intuitive, and I think we'll see more and more of those things happening. So I think it's definitely coming to healthcare. Certain parts of healthcare and drug discovery and development processes will adopt it faster than others, but hopefully we'll see a massive efficiency gain, and allow people within healthcare to do what they signed up to do, what they're best equipped to do, and hence drive higher patient satisfaction, but also higher satisfaction amongst nurses and physicians.
You know, it's interesting. I did a fireside with Vinod Khosla, just a really famous investor. If he makes the list this year, I think it'll be 18 times on the Forbes Midas Touch list as a world top investor. And he talked about the embodiment of AI into robots would be unimaginable just even in 5 years. And this is sort of proliferation. So clearly a great use case in the clinical or in the hospitals and senior homes, things like that, right? So, and especially with these new models that can generalize, like this Helix model that Figure has, or Unitree has a home robot they're releasing for 16,000, right? So it's kind of remarkable. And then you were talking about the closer you are to kind of the expression, like in proteins, and I know Denis Hassabis and his colleagues, they won the Nobel Prize in chemistry. They picked it up in December, but it was announced in November, where amino acids fold into proteins. But now they're looking at simulating the entire cell. And so not just the 3D structure of proteins, and if you understand that, there's so many different applications, but then also the interaction of those proteins with RNA, DNA ligands. And now they're working at the actual cellular level, and then you can go to the organ and more. So again, the profound implications, and you're in the middle of all of this. You've seen these announcements. Microsoft just came out with Majorana chip, which uses topological kind of quasi particles, right? And they indicate they can scale this thing, so maybe get 1 million on a chip. And then you saw the Google Willow quantum announcement. You saw Ocelot from Amazon a few days ago. You see Side Quantum indicating they will get it to 1 million qubits using photonic technologies by 2027. And Quantinuum just doing this constant sort of announcements. And then recently I had a talk with Bronson Masur, who's the kind of the director of science, Oak Ridge National Laboratories, and they came up with the first exascale supercomputer, but they're also have integrated quantum with that as well, at AI machine learning, because he says it's infused across everything there. Do you actually look at what's happening in that space at all, sort of the confluence of supercomputing, quantum with AI machine learning, because there are implications in healthcare, right? So
I think the implications of those technologies are more on the drug discovery side than on the delivery of care side of things. And I think, I mean, AlphaFold really revolutionized how we look at protein structures, right? Like, so I think there's definitely a lot of gain to be had in terms of R&D productivity for life sciences organizations and drug development in general. I mean, it takes 12 years and $2.6 billion for us to develop a drug. And because of that amount of capital intensive commitment that is required, there are many diseases and many conditions that are just not financially lucrative enough for for-profit companies to pursue and to go after. And that's why we have some incentives around rare diseases in this country. But what about global health? There are diseases that are not probably more prevalent in the tropical countries or other parts of the world that are not that prevalent in America. And hence, there is little incentive for us to find cures for those. So there are questions like that, which I think the more the more the cost of computing, cost of storage, cost of sharing data, all of those things, just as we drive those things down and we improve our computing power, we can just biology is very complex, and to process all of the structures and compositions of these molecules is not a non-trivial task, right? Like we have companies like, for example, Inveda Biosciences that is looking at the entire space of naturally occurring molecules and compounds that could be leveraged for finding potentially therapeutic compounds and molecules and developed into drugs. That's a massive space of chemical structures and molecules to be discovered and analyzed, and to be figured out which ones can you tweak in what ways to develop into actual drugs for patient populations, right? Like, and things like that require an extensive amount of computing and can certainly benefit from AI and quantum solutions at when you're trying to do screen for molecules at that scale. Um, so there's definitely applications, massive applications in the drug development landscape, and that will also eventually translate to this concept of precision health, which is which drug is right for which patient. And if you can analyze the patient populations in a lot of granularity and depth, and also understand the drug mechanism of action and patient selection for specific trials, like I think you will improve the odds of success of a drug compound, and you will also improve the quality of care and cost benefit equation for many of these patients who are currently on drugs that don't work for them. I mean, an average antidepressant drug works on 40% of the patients who take it. That's less than 50%. So the drug is ineffective 60% of the time it's given. So there are things like that that would certainly benefit from doing very deep simulations and matching on which drugs are right and at what point in time for which patient populations.
I was reading about the ESM3. It's a AI model that allows you to predict the 3D structure of a protein that's never existed, and then you can synthesize that protein for a particular problem or a cure, perhaps, or something like that, right? And they're claiming that or some people, I guess, have said that maybe it condenses 500 million years of evolution into moments. Have you looked at that kind of synthetic side at all, or you're sort of poking around in that area at all?
Yeah, I mean, this is exactly what I was talking about as in terms of moving towards artificial biological intelligence, right? Like we can now look at generating, architecting, synthesizing not only DNA but also molecules that are further down the expression line, like RNA, protein, metabolites, that can lead to our desired expression. And we have already seen this done at some microbial levels. We've seen this done with companies that are trying to generate a specific version of a microbe that can ferment wine a little bit differently. So you'll get wine that's like 10% sweeter or 5% lighter, those kinds of things. So we've seen it done in very simple genomic structures. But what these revolutions in AI and these models like ESM will allow us to do is to move it to a much larger scale, going into animals and primates and humans, actually, because now we can process that amount of data and that complexity of data when it comes to different molecular structures.
Yeah, Shubhra, you're like a genius, right? You're so capable. And your background is so powerful. I could spend hours just talking with you. Unfortunately, we're down to our last few minutes, and maybe a couple of minutes more. So I'm going to have to go to our last question, and the last question is, what recommendations or questions you want to leave the audience?
I would say this is the most exciting time to be alive. There is more opportunity than has ever existed before. It's a there is a tremendous opportunity for us to expand the pie and go where no human being has gone before in terms of discovering new drugs, providing better care for our patients, really building a healthcare system that truly works and that we are happy with and proud of. And it starts with um, understanding what exists today. It starts with understanding the workflows, understanding the incentives, understanding what works and what doesn't work, understanding what different people in the ecosystem care about, and how they are motivated. And once you understand those things, the tools that exist at our disposal today are better than they have ever been before. So the barrier in healthcare is not technology. It really has never been, but more than ever before, it certainly is not technology. I think it's just understanding how the healthcare ecosystem works and leveraging the tools, the technological tools that we have at our disposal today to move the needle forward in how quickly we develop drugs, how efficient we are with our resources, and how we can care for our patients in the right way, at the right place, in the right time.
And I'd like to close by saying, Shubhra, the world, so Dr. Shubhra Jain, MD, you have this background engineer from Stanford, the MBA from Morton, you have this investment background, you have this research into practice background, and you are the superstar in healthcare and in health tech and in so many different ways, and definitely a role model and leading the pathway for a much healthier, better future, including in population health. So thank you for coming in and sharing your experience and your wisdom with our audience.
Thank you for having me. This has been a pleasure.
Thank you for listening to the Brand Called You videocast and podcast, a platform that brings you knowledge, experience, and wisdom of hundreds of successful individuals from around the world. Do visit our website www.tbcy.in to watch and listen to the stories of many more individuals. You can also follow us on YouTube, Facebook, Instagram, and Twitter. Just search for the Brand Called You.